First day at work, what do you think? Am I looking pretty fly? Look at the twins.
Lori, you went viral, almost 5 million views, documenting your bruising after getting full mouth dental implants at Nuvia. And I know a lot of people were like, yeah, I do not want that to happen to me. So today we're going to dive in to what really happened and how you feel about your teeth now. But first things first, let's see what you look like just after a few months of recovery. Let's get in close here.
Here, let me pull up. You like them?
Wow, they're beautiful.
They're amazing. Yeah.
You would never think that a few months ago you had so much bruising going on, you know. That's
my face. I'm good here.
Let's go.
Swelling's gone. I got a sunburn. Sorry.
We always can use a little blushing in the summertime, right?
Yeah.
Well, let's rewind to where it all started, which was surgery day. Your surgery was actually a little bit different than most people's because you actually walked in with implants already on because you had snap-on dentures. So tell me kind of what did they do during surgery? What did that look like?
You go to sleep. And so it's very safe. I felt confident in the team that was around me. They actually remove any implants that you already have. They shave down your bone a little bit if they can to make more room in your mouth for new teeth. And then the next thing I knew, I was being woke up and they were handing me ice packs, and it was really simple.
The surgery part itself then wasn't painful because you were asleep, right? Did you feel anything?
Yeah, there was no pain even the first day.
Wow.
When I went home. Yeah, you're numbed up for a while. So first day is easy.
Before we kind of talk about when the bruising, started to settle in, I'm curious, whenever you first got your teeth placed, you came in after surgery the next day to get them in. Did you like the way they looked at first? Like, what was your initial thoughts of your smile?
I got permanent teeth in 24 hours. I did it. Yes, but the swelling had started right after that appointment. I think my first day there was no real swelling, just a little bit of inflammation as to be expected. It was after I got my permanent teeth in that my own immune system was like, I don't think I like this, and started having a reaction, and I started swelling up a little bit. That's when the bruising kind of started, and my mouth was so swollen that first day I had to go because I couldn't see them. I couldn't see my teeth. I had to it was swollen, really swollen that first day. I'm not gonna lie. But yeah, I was happy to have teeth. They looked great.
And in 24 hours, might I add. That's pretty incredible.
In 24 hours, yes. As promised.
Well, you continued to document your first few days on TikTok as the bruising began to kind of amp up. What kind of sensations were you feeling at the time? What was the pain like? Tell us more about how it felt.
It wasn't painful. If you want to talk about when I'm not going to lie to you and say there was no pain. Day 1, minimal pain. It's controlled. You're numb. Day 2, that's when, you can feel like you've had something done. You want to keep your ice packs on your face, keep in a sitting up position. You don't want to lay down and have, even though you're uncomfortable, don't want to lay down and have the pooling start and inflammation. It was uncomfortable for a couple of days, but the bruising was never a physical pain issue. It wasn't hurting me.
Wow.
At all.
That's so interesting. Well, I do want to take a look at the TikTok that did go viral and kind of react to it. So let's take a quick look really fast.
First day at work, what do you think? Am I looking pretty fly? Look at the twins. Right? And now I've got the yellowing going on, so that says we're in the healing phase. I'm a nurse here, I wouldn't lie to you. It's more yellow now than it was this morning.
So I have to ask, what does it feel like looking back at that clip? Like, what thoughts are kind of going on?
I had started a new job, And it was my first day. I wasn't expecting to, I thought a week was going to be fine. I wasn't expecting to go to work, but I was all black and blue. I was afraid I was going to be embarrassed and humiliated. At the time, I had agreed to work as a drug and alcohol rehabilitation nurse for a little while. And it, it actually turned out really well. It
Wow.
turned out to be a benefit for my patients. A lot of people who do drugs and alcohol end up with bad teeth. And I'm sorry to have to throw this in there, but your teeth, you end up with no teeth, missing teeth. People who've done meth or even alcohol can cause tooth damage.
Mm-hmm.
And when they asked me, "Oh my gosh, what happened to your face and everything?" and I showed them my new permanent teeth, they were calling me a warrior. I was telling them, you know what, there's life after. You're getting clean right now. You're going to focus on that. And then when you get everything together, you're going to get your smile too. And it was, a lot of them
Oh.
saw it as like hope.
Is it worth it? Absolutely, 100%. Um, it's given a lot of my patients hope. I didn't do this to show anybody anything, but it's turned into something more.
So I could even cry thinking about some of my patients. They were so sweet and so accepting, and it was a great community, and they loved my teeth, and they felt like they had a future. So Nuvia did more than just help me. You helped dozens of people in recovery. So
That's honestly so incredible. The fact that you were going into work like, oh my goodness, what are people going to say? There's so much bruising happening. Like, but it ended up like being like, hey, it started a conversation of like, hey, this is actually giving others hope to like what you could do in the future. That is beautiful. Like, who would have thought that, right?
yeah, it was pretty awesome. I told them all that they were permanent teeth, and told them about me going through with dentures and everything. So I mean, there's hope. There's hope.
Well, I'm also very curious, when this bruising is happening or even at its worst, or did you ever have a moment where you were like, oh my goodness, like, what did I do here? Is this going to be permanent? Is this going to change the way I look? Like, what kind of fears did you have maybe at this time?
My biggest fear, honestly, was my own vanity. I got longer. I was longer in the lip right here after I got my dentures, my snap in, snaps out, right? And Nuvia did the best they could to like help lift this up. But with my age and everything, I just feel like I was long in the, what do you call this, lip?
I
Long
don't
in the
even
lip.
know.
I was long in the lip. And you go in with this imaginary vision of the way it's going to look, and it's going to roll back the clock 20 years. And did it? No. So it was my own thought. I'm not going to go in at 57 years old, get teeth, and then come back looking like I'm 30. That's not the way life works.
Gotcha.
So I was disappointed there for a minute. I'm not going to lie, but there's really been nothing negative. Nothing negative. I feel good about myself. I'm eating better.
Yeah, I mean, I can imagine also getting a whole new set of teeth. It's gonna take some adjusting, right? I mean, I don't think immediately it's gonna be like, all right, cool, it looks great, we're good. Like, there's gonna be some sort of adjustment there.
There was a sign that I might have an infection starting. So I called them up, and they were like, "Oh, well, we're going to put you on antibiotics right away." I've been fine ever since. We knocked it
Great.
out right away. So if you're getting your Nuvia, you're feeling any type of way, they want you to call. They want you to keep in touch. Don't sit there and go, "Oh, I don't want to bother anybody." No, call. And they've got a solution. I don't think there's a thing that you can come up with that they don't have a solution for. I love Nubia. I'm really happy about it.
Amazing. Well, I mean, here's the thing, right? When you get something done, you're making an investment when you're getting these teeth, right? So you want to make sure you're taking care of them so you can protect them and
Absolutely.
hopefully have them the rest of your life. And I know a lot of people in the comments of your viral video were asking like, hey, what's the cost? What's the cost? And actually below this video, if you guys are watching and curious, hey, what could this cost me? There's a dental implant cost guide that we put together that they could definitely check out. But Lori, I'm also curious, did they prescribe you pain medicine at first too? Like right after surgery?
There's a painkiller you can use. Um, there's a couple of days where you're gonna be like, oh Lord, this painkiller, thank the Lord, because you've just had something done to your mouth, you know? Like
Right.
it's a surgery, it's a thing. Having that painkiller was vital, and the ice packs.
Mm.
The ice packs, you guys have these ice packs, get one empty and one full on your way home. One full ice pack, you keep it on. They've got you wrapped, it wraps around your face. Then have one empty at home so you can have one full and then just switch out already, you know, like in the freezer, fill one up for like later when this one gets a little wet. You can just swap them out. Have your husband refill your ice packs for you. Keep the ice on your
Yes.
face.
I love it. Well, whenever you were bruising, did you ever like reach out to Nuvia too about that? And were you ever like, hey, what is going on? Is this normal? Or did you have concerns there? Or what
I
was going through your
wasn't
mind?
worried about it. Honestly, I knew it was my body's own reaction to the trauma. Going through nursing school, you learn the different levels of bruising, what happens, when, why. If you cut your finger, the way your body immediately starts sending out little repair units.
Mm.
That's why it turns red, or it weeps. You know, if you cut your finger, there's an instantaneous thing that happens with your body to repair any trauma. So my body perceived more trauma, I think, in places. There was no trauma. I had a little bit of an overreaction. Not everybody's going to have that,
Uh-huh.
but it's just visual. It didn't cause me more pain. It wasn't like I got beat up or anything. I didn't feel that way. That video didn't come across the way it was intended. I was making light of my face and my bruises and a little bit of my embarrassment that I had to start my job that way with the bruises on my face. And I just was putting it out for the few people that are on every one of my videos that are there for all of my stuff that I post, all my silly stuff. And I just thought it would be like, haha, look at my face. And then people were like, whoa. And it really took off. And some people thought, you know, I'm never going to do that. But you're really selling yourself short, because this is the best thing I've ever done. This is life changing. It's changing the way I feel about myself, changing the way I eat. I'm sure it's going to impact my health if I don't eat too many caramel apples.
Yes, we can't wait for that 4 months so you can start eating those.
Yeah, it's taken away an edge of my anxiety even. Like I've got pretty bad anxiety, or had, and I feel like I feel better than I have in 30 years, honestly. I just feel like I feel on the inside like I'm 26. So I identify as a 26-year-old. You cannot just pretend.
Yes.
I'm 57. I'm 57 on the outside, but on the inside, I'm 26. I just want you to know that.
I love it. Well, what I find super interesting too is you did mention on one of your TikToks too that when you got your snap-in dentures, like your implants for that, you kind of had a similar reaction, right? So
When I got my dentures in, my face swelled up and I had an overreaction to the surgery as well there.
why do you think you do bruise as badly as you do? Like, do you have any idea?
My immune system is so dramatic. Trauma. It's just the way my immune system reacted to having, when I had all my teeth pulled. I don't remember how many teeth they pulled to get my snap-in dentures. It was similar. I had bruising and swelling, looked like somebody beat me up with a stick, or like I got in a car accident or something really horrible happened to me. And it's just the way my overreactive immune system just thought they needed to send out extra support, I suppose.
They're just being extra protective.
Yeah, extra mine. Yeah, I'm very dramatic. Very dramatic.
Well, those out there also might be wondering, especially in the comments, why does this happen to some people versus others? And here's actually what one of the Nuvia doctors said.
That healing period can look very different for different patients. It is all dependent upon the medical history, the healing type, the body type, generally speaking, how prone people are to bruising or swelling. I would say most of my patients come in the next day, even a few days later if they need to, with very minor swelling, very minor bruising, perhaps something around the corners of their mouth, perhaps something around this area. But patients who have, let's say, a history of blood thinner use, even if we stop the blood thinner before and or after surgery, of course with the permission of their primary care provider, can experience much more intense bruising, dark bruising all throughout their face. And then, as with any bruising, they'll start to note as it heals, it kind of starts traveling down their neck, sometimes even onto their chest, as the body filters through this old blood through the lymphatic system.
What do you think about that? I'm curious.
She's spot on. Like mine went down all the way. I thought like, oh, it's gonna go all the way down to my xiphoid process. I'm gonna be like, it was onto my chest. It was my eyes, my everything. And part of it, oh, I should have mentioned that because of my difficulties with eating for over the years, I became a type 2 diabetic. It's easy to eat junk food, pasta. You have less available to you, especially when you think your dentures are going to break every 5 minutes, which mine were. My dentures would snap in half constantly. I'd be out on a date with my husband and I'm eating a steak and I have to spit my broken dentures out in my hand. That was the snap-in ones. I want to be clear that I don't have that problem at all with Nuvia. As a matter of fact, today I'm a controlled diabetic. So once you get diabetes, once you get type 2 diabetes, you are a type 2 diabetic forever. And if you get your A1C under control, then you are a controlled diabetic. So I am today a controlled diabetic, and I'm looking forward to all the nice, wonderful, healthy things that I'm going to be able to eat and enjoy, and fun anniversaries I'm going to spend with my husband at fancy restaurants without having to worry I'm going to have to be embarrassed or spend a shift with no teeth in my mouth in front of patients.
I can only imagine, because those things don't come out, right? Those things you got
No,
now?
never. No, if you guys have to have a reason to take them out, which I don't know of one, but I would have to go in but no, they're in. And as long as you take care of yourself, brush your teeth, rinse, use your dental pick, I wouldn't foresee any reason to have to take your teeth out.
I'm curious too, when did, the bruising and the discomfort, even the swelling, when did all that start to kind of ease down for you?
Oh gosh, by day 4 or 5, it was minimal. I was on ibuprofen and Tylenol then at that point. If you rotate Tylenol and ibuprofen, every few hours, you can kind of keep it on board and do your liver a favor.
So you said the pain, like discomfort itself, started kind of easing off day 4 or 5. What about the bruising? Because obviously the bruising, there was a lot happening, right? So when did that fade away? Like when did you start looking normal?
For me, it was longer than most people, I think, would. Maybe it's because of the diabetes, could more than likely be because of that. Like I said, it's just visual anyway. And I had black and blue here and there for several weeks. Probably, I would say, into my 4th week. Even after my 2-week checkup, I walked in and they were shocked that my face still looked similar to the big viral video, even after 2 weeks. But that's just my own experience. That's not going to be everybody's experience. And don't let what my face looked like prevent you from changing your life. I can't clarify that enough to people who saw that video and thought, oh my God, I'm never getting implants. You need to reevaluate that thought. And would you give up your kids having to do that again? That's, people have 4 or 5 kids, so it's worth it to go through labor and delivery, right? And it wasn't anywhere near that.
No, it's a great way to look at it, though.
Yeah, I mean, you change your life. You change your life. What would your personality be if you had never had to get dentures, or never had gaps or rotten teeth or missing molars, or like when you get to the point that you want to get permanent teeth in your mouth, there's a reason why you're doing that. What would your personality have been like had you never had to get to where you are to have this thought, I need dentures? What would your personality have developed into? How outgoing, how confident, what job can you reach? You really got to put it in perspective that this is going to be the closest thing to what you would have had you never had bad teeth in the first place. And your true personality is going to shine through. You reach for the stars, man. Absolutely. Nuvia is like reaching for the stars.
What are the biggest changes that you've seen or noticed in yourself since getting this done?
Confidence. That's my biggest thing is I feel more outgoing. I feel more confident. I'm not afraid to smile. I feel, you know what? I hadn't really thought of it until just now, but I can't remember the last time that I felt like people thought I was mean.
Wow.
Like before, when I had my teeth, I didn't want to smile as much. My smile was more like that, and not your genuine open mouth, or I would put my hand up, to cover my mouth. And I guess I haven't thought about it, but I don't feel self-conscious. I don't feel that social anxiety anymore. Feel like I'm the open person that I would have been if I never had to worry about, oh, what do they think of my mouth? What do they think of me? That insecurity is just gone. I'm just a person doing whatever. I don't care.
Yeah. It sounds like peace of mind,
Yes. It's not just your metabolic health that you need teeth for. It's for your own personal well-being and your sanity. And I feel good.
That's amazing.
It's helping my anxiety too. Yeah. So any amount of money that it's costing me to have these, I'm worth that. I'm worth that. And I think I'll live longer because of it. Because when you change your outlook in life and you change how you eat and you change how you feel, positivity is longevity. I'm just saying.
Well, someone who's watching right now and maybe saw your bruising videos and thought, well, was it worth going through all that? What would you say?
100%. 100%. I would have taken 27 more bruises. Yeah, my whole face could have been black and blue for 6 months. It would be worth it. If I was black and blue still today, it's worth it because I know what's on the other side. And I know I feel confident and happy, and I'm back in cardiology where I belong. Cardiology.
Well, that says a whole lot. It says a whole lot. And it's only, a few months in, right? So there's much more things for you to discover about getting this new smile. So hopefully down the line, we can pop on another podcast and talk more about this.
Anytime at all.
Well, for those watching out there and curious, what could this cost me? What does this look like? Make sure to download that dental implant cost guide I mentioned earlier. It's going to be in the description below. Take a look at that, see how people have made it possible for them. But Lori, thank you so much again for being on this podcast with me today. I think it's great to get insight to, hey, even though, it might have looked pretty bad, it was worth going through in the end. So I appreciate you coming on.
100%. Yeah, do it. And you know what? Your first appointment when you go down there, I think it's free. You're going to go in there. They're going to tell you whether you're a candidate. They're going to take some pictures. They're going to take some x-rays. And they're going to tell you what it would cost you. They're going to give you the cost breakdown. There's no obligation to go down there and just see. And you get an overall idea of what Nuvia can do for you. I love the way I feel, and I want everybody to feel this way too. So go get the free exam. That it's a starting point. I didn't expect to walk out a week after my first appointment. That wasn't my plan. It was just to go see what it was about. And a week later, I had teeth. That's how fast it was. A week. It was a week. I went in. I was like, yeah, I'm just gonna go see what it costs. And then a week later, right? Yeah. Treat yourself.
It's so crazy how fast it can happen. It's so crazy.
Yeah. Absolutely.
Yes, treat yourself. I love that.
Treat yourself.
Awesome. Well, yeah, there's also a 60-second quiz that you can take. I'll put it next to that cost guide in the description where you can find out if you could be a candidate. And then from there, go in for your consultation. Talk to them about what's possible. That's what Lori did. And here she is now. So
no obligation. Just go in, check it out. If it's not for you, leave.